Oh, you guys are fine. I mean, the people on
You're everybody silence themselves wherever you are.
right. I was just getting a lot of feedback from some of the other mics.
Is that better now?
Yes. So my name is Kevina Parker. Now it's now Daniel, but I still go by Parker. Yes. So I have been a pelvic floor physical therapist for about 4 years now, and I have been in Tallahassee for a little over 1 year now. So I've been right with TMH that whole time. I went to school. I went to Florida State University for my undergrad and master's. I did athletic training for undergrad, got my bachelor's in science there. And then I also did sports science for my master's. Now you're probably like, how all this sports come into play with PT? But I ended up going to PT school here at FAMU, also in Tallahassee. And we had a course on pelvic floor therapy and what that entailed. And I was just so, amazed that there is something that can help, not only women, but men and children also who are having issues with their pelvic floor. And I just remember, my grandmother, she struggled with different things and kind of what coming up and seeing her struggle and not be active in her community and doing the things that I know she'd love to do. So it just kind of changed how, I thought about, okay, there's not a lot of pelvic PTs. This is something I think I really want to do. So I took a internship and I got some experience. And after I graduated, I started taking courses and I was like, wow, I was really amazed at how much pelvic floor PT could do. So it was funny, Ruth and I came up, we were brainstorming ideas for the title of this presentation today. And so we came up, gut leakage, pelvic floor PT can help with that and a lot more. And so as I progressed and learned more and educated myself, now I want to be able to educate, those who are in my community and who are maybe dealing with things that they don't know what to do about. And I just want to let you know that we're here. Pelvic floor PTs are here in Tallahassee and that there are options available. So let's go ahead and get started. As Ruth said, we can go ahead and, get those questions going. If you have questions, put them in the chat and, maybe just raise your hand if you're live here with me and we'll kind of keep it going. Okay. So let's go ahead and get into it. So have you ever heard any of these things said before? Either you've said them or you've heard them said. I must have a bladder the size of a pea. And so it's just like, I'm going all the time because my bladder is so small and maybe I'm not urinating a whole lot each time I'm going either. Or what about this? Whatever I drink goes right through me. Like it doesn't seem like it's able to kind of sit and kind of stay there, maybe like it used to, or maybe ever. Maybe that's always kind of been your thing, Alrighty. Or what about this? Feels like my insides are falling out. Sometimes that can happen. Maybe you know someone or you yourself personally have experienced that sensation or have actually seen something that doesn't quite belong there that's there now. Okay. Alrighty. How about this one? Sex just hurts too much. We're not going there. Not going to go there. Okay. So, and then, I always wear a pad just in case. Just no ifs, ands, or buts. Like just I'm going out, I'm wearing a pad. I'm in the house, I'm wearing a pad just all the time. All right, and then what about this one? Once I feel the urge, it's too late. So, yep, I'm getting some nods, I'm getting some head nods here. What about this one? I better bring a change of clothes or underwear, just in case I laugh, cough, sneeze. Sometimes that can be a big one. Or sometimes, I don't have this on here, but some people don't even leave the house. I don't want to go anywhere. I don't want to have to deal with that embarrassment. I don't want to have to deal with, you know, any kind of repercussions or get somewhere where, you know, oh, this one, I don't want to go anywhere because I don't know where the bathrooms are. Like, oh, you know, I have my route. You know, if I'm on my route, everything is good. I can stop at that Target. I can go to that gas station because I know it's clean. So just different things we kind of put together and piece together when we have things like incontinence. But yes, but some people just decide, you know, I'm not going anywhere because I don't want to even deal with any of this. So, and I'm sure some people have gotten to that point. Well, maybe there's nothing you can do about it, but just live with it. So some people, maybe that's been the advice you've been given from either friends and families, or maybe your doctor has said, you know, this is just a part of the aging process. You know, I've gotten that sometimes when patients come in, or maybe, you know, someone said, oh yeah, you have to have a surgery to get that fixed, you know, or you have to have a surgery to lift that up and tuck that in and, you know, do different things. But what if there's another option? Okay, so I'm just here to kind of present that option to you. You know, it's not a quick fix by any means, but it is a way that we can begin to kind of deal with some of the issues that affect us as we, not only as we get older, but even as we are when we're younger also. Okay. All right. So what is a pelvic floor? So I'm a pelvic floor physical therapist. And a lot of people are like, okay, well, I think I know what the pelvic floor is, but maybe not quite sure. So I don't know if everyone online can see me if I move the mouse around on the screen. You guys can't see that, so they
Yes, we
probably
can see it.
Oh, you can?
Mhm.
It's moving?
Yep. Little
We can
white
see.
arrow.
Okay, perfect. I couldn't see it on the big screen in here, but you guys can? Oh no. Okay.
No, but I have seen, people will tell me
The
that they
point,
see.
there's a
Just try
pointer.
moving it more, and you're seeing it on yours, but I'm not seeing it.
Okay, so I'll kind of point. Alrighty, so so down here in that colored portion, we have our pelvic floor muscles. Okay, so all of these muscles are at the bottom, and I'll kind of use my pelvic model here at the bottom of our pelvis, essentially. Okay, so there are these muscles down here. So what happens is these muscles all work together and they perform various functions of the pelvic floor. As you can imagine, you know, if when they're working properly, they're going to prevent things from falling out. Okay, so that's one of the big functions there. But there are other roles that the pelvic floor plays. So not only are we getting sphincter function to kind of make sure our sphincters, you know, for our ladies, we have our, you know, our urinary sphincter, we have our, you know, our vaginal canal, and we also have our rectum. So those three things are being, you know, supported. So then we also have our organ support. So it's kind of helping keep the organs lifted and in their proper location and supported overall. Then we have core support. We'll talk about this, you know, as we become more and more sedentary, I'll say that, we begin to lose our core support, and that's going to also play a role into our pelvic floor muscles. Sexual function is also a part of the function of our pelvic floor muscles, and even circulation. When those muscles are pumping correctly, you know, we have blood vessels and things like that that are kind of coursing through our pelvis and our whole body. And so when those muscles contract and relax, that acts as a pumping function. So we're not getting a buildup of swelling, or, you know, everything is moving and being flushed out as it should. Okay. All right. So what I like to use this picture here it shows a couple different things that as a pelvic floor physical therapist, I like to hone in on. So of course we have our pelvic floor muscles there at the bottom. I like to think of that as our sling, our base, okay? Then we have our back muscles, okay? Our little small muscles that are in between each little vertebrae there. And then we have our transverse abdominis muscle. It's a deep core muscle. So it's underneath those muscles that give us the six pack. So, but when it contracts, as you can see, the way it's oriented, kind of side to side there, when it contracts, it kind of acts like a corset. So when I like to, in pelvic floor PT, when you're going to see someone, they should be looking at what your core is doing, okay? And our diaphragm. A lot of people don't think about their diaphragm too much when they think about their pelvic floor, but you'd be surprised how much everything is working together. So when we inhale, what should happen is our diaphragm comes down. It allows for a good inhalation, good expansion of the lungs. That should also relax our pelvic floor. However, for some reason, over time, a lot of people begin to breathe in through their chest, and that diaphragm doesn't have a chance to go down. It actually kind of stays up. So what happens to pelvic floor? It stays up, and it never really gets a chance to fully relax. So that is also something we address in pelvic floor PT, okay? Alrighty, so now what is pelvic floor PT? In a sense, we're gonna identify and treat the underlying cause of your pelvic floor dysfunction. So relating that to the actual state of the muscles. Are they weak? Are they tight? A lot of people think, oh, I'm having leakage, I must be weak down there. You would be surprised how oftentimes, that's not always the case. There can sometimes be so much tightness in the pelvic floor that the muscles just don't function properly. So they're not able to get into that relaxation portion. So for my ladies, who have been doing Kegels for years and nothing has changed, there might be something else going on, okay? Alrighty, so pelvic floor PTs, overall, we're gonna try to help improve your quality of life by providing conservative and effective treatment for issues that arise from and affecting the pelvic floor. So not always, it's kind of sometimes the chicken or the egg scenario. Is it pelvic floor that's causing dysfunction, or has there been some kind of dysfunction, back in that kind of breakdown of this image here? Has there been something that happened to our back, to our abdomen? Have we had a surgery in the abdomen? What's going on in our other structures that may lead to pelvic floor dysfunction? So that's kind of what I'm here for, and what I kind of try to figure out along with you. Alrighty. So what is a pelvic floor dysfunction? What are we going to be treating? So one of the big ones, urinary incontinence. So that's probably a majority of the diagnoses that we get, urinary incontinence. Now, there are different types of urinary incontinence. Our first picture are some of these pictures, they're doing things, they're on the way to the bathroom, at nighttime, nighttime leakage can happen. But the main ones, you have stress urinary incontinence. Think coughing, sneezing, lifting. Those types of urinary incontinence come with a stressor, okay? So you have leakage when you do those things. Or sometimes you might just get an urge, like, oh, I just really have to go to the bathroom right now. And, anyone who's in my way, I'm sorry, you're going to get run over. So that kind of leakage, you're on your way to the bathroom, you're not getting there in time, you're having leakage, that's that urge incontinence. Now, there can be a mixture. You might have a little bit of both going on. Or, maybe it's only happening at night, things like that. So we're, in our sessions, we kind of talk about what's really going on. What kind of urinary incontinence are you having?
Excuse me, Kevina,
Yes.
there's a question in the chat.
I have a question in the chat.
Yeah. Can C-section births impact pelvic floor?
Okay, so the question on on here. Can you guys hear?
No, so you'll have to repeat. the
Okay,
question.
so the question in the chat was, can a C-section birth impact the pelvic floor? And I'm going back here a little bit, but yes. So anything that kind of disrupts this, anything that kind of disrupts this, any back, any in the abdomen, you know, with our breathing, with our pelvic floor itself, when there is, you know, a surgery, think about what happens with the C-section. You have to cut through all those muscles to get down to the uterus. Or, you know, when they do scopes and things like that, they have to cut through all of that. So that's going to disrupt the core. So that's going to bring in weakness. That's going to bring in scar tissue. That can bring in, you know, that can also lead to tightness. So all of those things can impact the pelvic floor. Now, also think about where they are doing the C-section. Is right in that, right above that pubic bone in the front. It's kind of right across here. Guess what's right there? Our bladders. Our bladders are right there. So think about what's happening if we cut across there. There's scar tissue, and not just on the top where you can see your scar. That scar is gone all the way down to through where they cut. So that is definitely something that pelvic floor PTs should be addressing if you go see one. If you've had a C-section, sometimes multiple C-sections, that can definitely impact the pelvic floor. Okay, so kind of hopping back up here. So we've talked about urinary incontinence, urinary frequency, urinary urgency. Okay, so these are the types of things that we're seeing in treating. Okay, so then there is pelvic organ prolapse. So you'd be surprised how many, you know, kind of by show of hands, who knows what a pelvic prolapse is? Who's heard of it? Okay, so, you know, when I was coming up, I was in school, they're talking about, oh yeah, prolapse. You know, I had no idea that our organs could begin to descend and possibly become exposed outside of the vaginal canal. I had no idea that was a thing. And so, you know, sometimes if you have that relationship with someone and they told you about it, you'll know about it. But otherwise, you know, sometimes you just don't know until it happens to you. And so how scary can that be? When when you wake up one day, or you know, you do something and you're in the shower and you're like, what is that? So a lot of people describe it as a bulge, or sometimes a heavy pressure sensation. And sometimes, you know, it's your doctor who's finding it first. You know, you go in for your annual and they say, oh yeah, you have a prolapse, let's get you in for surgery. And you're like, wait, what? For surgery for what? And so there are different grades of prolapse. And on here, there is a, you know, 0, that's kind of where we are originally. And then sometimes after childbirth, after improper breathing techniques, after improper lifting, after bearing down, constipation, just different things that are going to push down on that pelvic floor, over time, we can start to see a descent in some of our organs. So, and it can be any organ. It can be your bladder. So the little organ in front, it can be your bladder that descends into the vaginal space. Your uterus can descend, or even your rectum. It can start to bulge and descend. And it can be a combination of these things, depending on your particular circumstance. So stages, you know, 1, 2 are kind of not exactly outside of the vaginal canal. They are kind of, I don't know if you can see that, but kind of stage 2, it's kind of right at that opening to the vagina. Then 3 and 4, they're actually outside. So those are going to be more severe and may actually require surgery. Now, if it's a mild issue with the prolapse, that's something that pelvic PTs can address. And so our philosophy is, I'm not going to fix your prolapse. I'm not going to make it you know, the structures that have loosened and slackened are more connective tissue and not always a muscular issue. So I can't guarantee that I'm gonna get you back up and tight and how you used to be before the kids, but we can do things and make sure we are performing in a way and going through our day-to-day activities in a way that we can make sure that we are not making it worse, kind of improving it somewhat and then not making it worse. So we'll talk a little bit more about that. So now there's also pain. So these are some of the big things that we deal with in pelvic floor PT. So now sometimes, you know, we get pain in that area, just how we have a sore shoulder or sore back, you know, they're muscles here. And so sometimes these muscles can lead to pain. Or not the muscles lead to pain, but the pelvis itself can be painful. And when I say the pelvis, it might be actually in the vaginal canal, it could be in the rectum, it could be, you know, our actual hips and our alignment. You know, we have joints in our pelvis. I don't know if you can see that on there. It's all kind of the same color. So that's our pubic symphysis, it's in the front. And then in the back, we have our sacrum that goes into our back and spine, and our ilium. Our ilia, they are big hip bones on the side. And so sometimes, for some reason, arthritis kicks in. There's, you know, laxity in the joints. There's weakness in the joints and muscles. And so this can contribute to some other issues with pelvic floor and vice versa. So those are things that we're going to address. So pelvic pain, no matter the cause, and that could be, you know, pain with movement, pain with intercourse, pain with things that maybe weren't painful before, just thinking of things like that. Then there's also constipation. I see a lot of patients in for constipation, or it's, and we talked about urinary incontinence, there's also fecal incontinence. So that happens. And you can imagine if people don't want to go out for urinary incontinence, they definitely don't want to go out for fecal incontinence. So just things people are dealing with. And then urinary retention. So this one can be a bit more complicated, but if you are not able to fully empty your bladder, you're retaining urine, that can sometimes be painful, okay? And so depending on what has caused that, you know, whether it's just some habits or maybe there's something neurological going on, you know, that's really going to determine the course of treatment for that. But those are also some things that we treat. And at the top, it says at any age. So yes, I am seeing patients, you know, maybe as young as 5 and 6. And my oldest patient has been in her 90s. So yes, so even kids have issues, you know, bedwetting. They're, you know, having accidents when they are, you know, a little older. Like you think that, you know, 9 and 10-year-olds would, you know, be well enough to, you know, get to the bathroom in time, or, you know, not have accidents. So just things like that, of that nature. And so even, you know, pelvic floor issues at any age. I have younger ladies who have, you know, never had children before, and, you know, they've never been able to insert a tampon because it's been painful, or, you know, have intercourse. I've had, you know, many different patients, you know, they're unable to have intercourse, whether it's with their husband or partner for the first time. And they're like, oh, I thought this would just come naturally, but no, it's an issue. So that pelvic pain, chronic constipation. I've seen prolapse in people who have never had kids because they've been chronically constipated. So just different things can lead someone to seek out pelvic floor PT. And so I think it's just important to know what kinds of things can I go see my pelvic floor physical therapist for. Okay. Alrighty. So what exactly do I do? So I'm going to listen. When you first come into the office, I'm going to listen to you because each patient is very different. each patient is going to have their own story of how they have gotten to the point that they're at. So I want to gain understanding into what you want to achieve also. So even though you come in, you might be having pain with intercourse, or you might be having, other issues going on, but you're like, I'm okay with that. I just want to deal with my incontinence. So that's what we focus on. So it's kind of what the patient, I always want to listen to you and kind of figure out what it is that you want to get out of this. Alrighty. So, and then when I look at your habits, what are we doing that might affect our pelvic floor? Are we hovering over the toilet? Are we not sitting on the toilet? How we kind of go into a public bathroom, we don't want to sit on that. So we just hover. But think about that. We want to make sure our muscles are relaxed when we're using the bathroom. If we're standing, there's going to be some contraction of the pelvic floor. And so when that happens, we're going to have to push. So then if we're pushing on contracted muscles, that's going to affect our organs. So it's all connected. And then I'm also going to ask you about what you're eating, what you're drinking. Oh, I drink coffee all day, every day. Well, that's a big bladder irritant. So I don't always say, hey, you have to stop all of your coffee. You have to cut it out completely. I have said that to some patients, but for the most part, usually I say up your water intake. We usually recommend at least 64 ounces of water, just plain water a day. And well, won't that make me go to the bathroom more often? It might, but we also want to look at what is going into the bladder. When the bladder has more concentrated urine through, just normal day-to-day bodily functions, through the things that we're drinking, but the urine is going to be more concentrated, and the bladder is like, whoa, I don't like this, get it out. So then you're going to have that urgency, that bladder is going to be contracting, and you're going to be rushing to the bathroom. And if you're drinking those types of things all day, you might be going and rushing to the bathroom all day. So it varies. So we're going to look into those things. What other bladder irritants are you consuming? What other things are we doing on a day-to-day basis that may kind of wreak havoc on our bladder? Some things that I get a lot are, oh yeah, before I leave the house, I go to the bathroom. When I get to, my destination, I use the bathroom. They're just kind of just going all the time. Not because they necessarily need to, but that kind of just in case voiding. So we can actually train our bladder to become a more on frequency side. So we have to be mindful of that. So there are certain intervals that we want to achieve, certain things that we want to make sure our bladder is doing. Okay. Alrighty. So I'm also going to examine your joints and your muscles outside of the pelvic floor. So what's going on with your back? What's going on with your hips and legs? How's your abdomen? Have you had surgeries here before? Are you strong here? Are you weak in the hips? Just different things you're going to look at, because at the end of the day, I am a physical therapist, and I'm going to look at a little bit of everything, because everything's connected. So I like to use this a lot, but the pelvis is like the center of it all. It literally connects our upper body to our lower body. So we have our back muscles and our back, our spinal cord that's extending up from our pelvis, literally. And so that's coming up. And then we have our hips and legs that are going down into the base. So if there's something going on here or something going on the outside, it's definitely going to affect what's going on here. Okay. So that's what we want to look at also. All right.
Excuse me, Kevina, we have another question in the chat.
Another question in the chat.
Is caffeine in dark chocolate an irritant to the bladder?
It can be. Is caffeine and dark chocolate an irritant to the bladder? Now, I will say some people are more sensitive to certain items than others. So for someone, especially and sometimes you might notice a change. Like you might be able, maybe when you're a little younger, to drink all the caffeine throughout the day to stay awake, to keep you going. And then over time, you might notice, okay, I'm going more frequently now. I'm getting some irritation actually in the bladder. But some people are going to be more prone to that sensitive bladder. So things like caffeine, sometimes chocolate can be an irritant, and dairy in general. Sometimes carbonation. So I get a lot of people go, oh yes, I drink water all the time. Oh, how much water? Oh yeah, I drink the bottles of the sparkling water, the mango flavored waters. And it's just like, oh, well, that is carbonated. So yes, it's low sugar or zero sugar. Oh, and the 0-calorie sweeteners, the artificial sweeteners can be bladder irritants also. So those Diet Cokes, those are double whammies. Okay. Things of that nature can be more irritative to the bladder. So that's why I always push the water. So I try not to, want you to give up all of your guilty pleasures, but definitely make sure you're upping the water. And I tell people, if you're going to have a can or a bottle of soda, drink that much in water, and then keep drinking water, but at least kind of get your 1 for 1. You drink your cup of coffee, drink your cup of water. So just so it's kind of trying to balance itself out. So yeah, so definitely thinking about those bladder irritants, kind of what are we putting into our body and how is it affecting it? Okay. And so going back to what does a pelvic floor physical therapist do, we're going to identify areas of imbalance. Maybe you've had a hip surgery. Maybe you've had a knee surgery or back surgery. Maybe one side is just chronically weaker than the other. Everyone has that strong side, right? Oh, this is my strong side. But we should be relatively balanced. So if we know for sure, like, oh yeah, this is my hip, I've had surgery on it several times, and that can show up in pelvic floor. We can have one side pelvic floor be a little stronger than the other. And so you can imagine how that might affect continence. Okay. So that's something we also want to look at. And so now we actually do examine the pelvic floor muscles themselves. So we're looking at the coordination, the strength, endurance, the tone of the pelvic floor. And so when we do examine, I'm going to pull this out again. When we do examine the pelvic floor muscles, as you saw in that previous picture, those muscles are kind of arranged in like a sling-like shape, okay? So when we are doing internal exams on the pelvic floor, we actually take a finger and we do an internal exam, okay? So depending on your comfort level, I'm always going to ask you, hey, is this okay with you? Are you okay with this? Is this something that you're comfortable with? Because at the end of the day, I can't get very far if you're uncomfortable, if you're already tightening and just like tense. There's other things we can do, but it's like going to the dentist, telling them, yes, my tooth hurts, but you can't look in my mouth. So it's one of those things that I can tell you, yes, I bit down on a piece of candy and now my tooth hurts. So you have that information, but in order to get a really good full story and picture of what's going on with you, sometimes we have to feel and kind of see and get under the hood, so to speak, and see what's going on. Okay. And so what that entails is, if I kind of hold it this way, you'd actually be kind of on your back here, but just so everyone can see, insert finger. And so we're kind of just moving around. What do these muscles feel like? Okay. Are they tight? Do they kind of sink down for like a little more than they should? Is it very lax there? Is there a lot of tone there? Is it painful for you? So I'm going to be talking to you the whole time. So it's not a time to just kind of zone out. I got to know what's going on. So then I'm going to have you contract. Can you contract these muscles? Are you using your bottom? Are we squeezing our legs? Are we, are we holding our breath when we're trying to contract? So those things shouldn't happen if you're doing your contractions, pelvic floor contractions or Kegels, okay? I shouldn't know that you're doing them. No one should know. They're like your secret exercise, okay? So that's something to kind of be aware of. And I'm going to look at your endurance. Can you contract these muscles and hold? How long can you hold? How many times can you hold that strong contraction? And then also, can you do a quick contraction? Can you contract quickly and relax quickly? Contract quickly, relax quickly. So that's going to look at your coordination of the muscles, okay? So that all together with the other things we talk about, with the other things I examine in the other structures in your body, and kind of putting things together. And that kind of just gives us an idea of kind of where to get started and how to move forward in your particular treatment plan, okay? So based off of that, we're going to provide a plan of care. So specifically for each individual patient, what does their treatment look like? It may vary. For one patient, they might be focused on relaxation. Can you relax your pelvic floor? And the other patient might be, okay, we got to strengthen you up. We got to strengthen these legs and hips and your core and abdomen and even your pelvic floor. So everything kind of comes in different packages for different patients, So that's what we want to really hit home there. So there might be exercises I'll give you, stretches that I'll give you, things, your posture. If we're sitting, we're hunched over all day, because we have a computer job or because we're sitting on the sofa or in our comfy chair and, just whatever we're doing. That posture, think about how that kind of compresses our bladder. So then our bladder is pressure sensitive. So if we're all, kind of crunched over like this, it's going to impact different things. So we just want to work on that. We're going to look at your habits. Are you going just in case? Are you drinking a lot of bladder irritants? We're going to try to modify some of the habits that we've gotten into. There are different modalities that we can use. So me personally, when I say modalities, think about, if someone's typically gone to pelvic floor, or not pelvic PT, but just ortho, PT, they might utilize some electrical stim on you. They might utilize some ice and heat, and they might do different things like that. So in pelvic floor PT, you might get a hot pack depending on what's going on. You might get a cold pack depending on what's going on. You might get something called biofeedback. So biofeedback, and we do have these machines at TMH. And so with biofeedback, we can actually kind of hook you up to a computer, either with a vaginal probe or more of an external apparatus. So there's little stickers that we can place on you, and we can actually read the electrical potentials, kind of like an EKG for your heart, but we use them on your pelvic floor, and it actually gives us a reading, and it lets us know when the muscles are kind of working and when they're relaxing. It doesn't give us a strength readout, but it kind of lets us know, okay, you're working the muscles, you're not working the muscles. So I usually preserve that for my patients who have no idea how to contract their pelvic floor. They're not aware. They don't have any, sensation, and I might not feel like their contraction is very strong, but it's there. So then we can kind of utilize the machine so they can see, oh yes, I am contracting. So then over time, that can kind of build up, and they can become more aware of their pelvic floor even without the machine. There's also electrical stimulation for the pelvic floor. This is another thing that I don't quite use often, but it is an option for patients who maybe have some overactive bladder symptoms, or maybe they're having other issues with leakage and things like that. And I would kind of use that as a last resort because I want my patients to utilize their muscles and be able to function properly. Because I've seen a lot of patients come back like, oh, yeah, we did electrotherapy at my last place. And so they end up back in my office. I'm like, oh, okay, well, so you've done the electrical stimulation, but my goal is that you don't have to keep coming back. You don't have to keep coming back to pelvic floor PT. I want you to get well and stay well. Okay. So yeah. Alrighty. So, and a lot of times I get patients, they come in and they're like, well, does this really work? So they come in, they're about to do the exam or they're just finished and they're like, wait, but does this work? So there has been extensive research in this field. Still lots more needs to be done, but there is right now a lot of evidence-based support supporting pelvic PT for pelvic floor dysfunction. And so when it's utilized as a first line, it's a low risk therapy with very high success rates. And in some clinical reviews, they found that stress incontinence 8 times more likely to have a cure or improvement. Urgent incontinence, women have fewer episodes of leakage. Pelvic organ prolapse, significantly reduced symptoms at 12 months. And vaginal pain, significant improvement in quality of life. You can imagine if someone's having pelvic pain and discomfort, how, annoying and irritating that might be. So pelvic floor PT should be recommended right after childbirth. I think it would benefit a lot of women to have, this education right after so that we can prevent and maybe even treat some of these things. So at this point, kind of wrap it up here. So any questions at this time?
I have a couple of more in the
Hold
chat.
on 1 second. I have one out here. Go ahead.
Oh, will there be another pelvic floor therapist when you leave for Austin?
Okay.
That's coming in?
So for those who might not have heard, we have a question here so I am going to be moving. I'm moving outside of Tallahassee. I'm moving to Austin, Texas. My husband has got a job out in Austin, so I will be moving out there. And as of now, we have 2 other pelvic floor PTs who are working at TMH right now. So yes, there are others to help and they are fantastic. And we all get along, we all kind of collaborate and kind of brainstorm and kind of think of things to help make our patients better. So so Lisa Whiting and Anna Height are currently the other pelvic physical therapists at TMH.
What about Janelle? What's your plan?
I'm still deciding ultimately what I want to do. I graduate on April 30th. So I'll begin work in July after I take my board exam and see where I want to get my college.
All right. And so Maureen, what were the other questions online?
Okay, the first one is, how long of a time is the probe test?
How long of a time is the
I think they want to know how
test?
long the test when you're testing, inside the pelvic floor with your finger. I think they're wondering.
Okay. So that is usually done within the first session to kind of just test the muscles. That could be anywhere from 5 to 15 minutes, depending on what all is happening. If there's, any discomfort or anything that raises concerns for me, we're definitely going to stop that internal portion. But depending on what's going on, I'm always in communication with the patient. If it's something that you're just very, very against, there are some other things that we can do. But like I said, it is one of it is the best way to gather that information about the muscles. But yes, usually at TMH, I can speak for TMH. Every clinic you'll go to that has pelvic PT might be a little different, but we usually have an hour and a half for our first session. So that's a long time, but there's a lot to get done. So maybe within the last, because we tend to say that for the last thing, depending on how things are going. But yes, so sometimes we might do it on that first exam if we don't have time, or, you know, if there's something else going on that the patient just wishes not to, maybe they'll be more prepared the next time, or some other time after that, we can get there also. But yeah, it can vary, but it's not going to be the whole hour and a half that we're doing that.
Okay, the next question is, does health insurance cover pelvic physical therapy?
Yes, so does health insurance cover pelvic floor physical therapy? So at TMH, we accept a wide variety of insurance plans. And so depending on your particular plan, if PT is covered, pelvic floor PT should be covered. Not should be, but it's covered. It's under PT umbrella. But yeah, so in short, yes, we do take insurance.
Okay, next question. Is there a form, or I guess something online somewhere where people can get some of the pelvic floor physical therapy exercises?
Is there a form online where people can get pelvic floor PT exercises? There are a lot of resources online for pelvic floor exercises. However, if there is something going on, if you're having, active pelvic floor dysfunction, like I said before, just because you're having leakage doesn't mean your muscles are weak. Doesn't mean you need to be doing exercise. It can be a little more complicated than that, but if that's something you want to try, see if it works, that is completely your prerogative. However, if things aren't getting better, I would definitely look into seeing a pelvic floor PT. But yes, there are tons of resources online. Is there anything specifically from TMH that's out there as far as exercises? No. But if you Google on YouTube, pelvic floor exercises, tons of things will come up. But I would definitely recommend seeing a pelvic floor physical therapist if there is dysfunction present. All right, so I have another question out here on the floor.
My doctor referred me in December, and she had indicated that you're backed up.
Okay.
But I haven't heard anything, and I called and left a message, and I didn't get any call after that. So I don't even know for sure the referral made it through.
Okay, so sometimes, so kind of back it up here a little bit. With the whole referral process and getting into pelvic floor PT, currently there's 3 of us, and there's about to be 2. So you can imagine, we're getting a lot of referrals in. So we do have a bit of a wait list. It goes pretty quickly, but I know sometimes there can be a bit of a wait list. Now, since December, you haven't heard anything. So I know this is probably a little more specific for your case, but if I can, maybe get your name afterwards, I can kind of check with our business manager to make sure you're on the list and kind of see if we can kind of get that rolling.
I'm wondering if you want to take the headphones out at this point, because then we get off here.
Okay, so let's see here.
Might save you from heating something.
All righty.
Okay.
Can you hear me?
Yes.
Okay.
Yeah. I have a couple more questions in the chat. Is that okay?
Okay.
First, someone asked, is the testing uncomfortable? I expect they mean the hand-on testing, but I'm not sure.
Is the testing uncomfortable?
Yes.
It should not be. I'll say that the testing that I do, the internal exam, it should not be comfortable. But if the patient's complaint is that they're having pelvic pain, it might be. So, we're not going in there our goal is not to cause you pain and, make everything painful, but just as if I'm pressing on a muscle, in your arm, on your arm or on your shoulder, if you depress a muscle, it should not hurt. Now, if it does, that might mean that there's something else going on. So that just gives me more information. But I will, when you're in pelvic floor PT, you're going through your examination. If something is painful, your therapist should ask about it, but definitely say something. Hey, that's uncomfortable. Maybe I feel pressure there. Maybe it's not really pain. And we're going to ask you, okay, well, how painful is it? Is it, are you jumping off the table? Is it painful enough that you want to stop? If at any time, you walk in the door, like, I don't want to do this anymore. Like that is completely, your prerogative. We won't be offended. Some people, they just get really nervous. I've had people come in and they're literally shaking because they're so nervous. They've had so much pain and trauma in the past. And so, like I said, it's not something that is a 100%, we have to do this today or else I can't see you anymore as a patient. It is just one of those things that's going to give me more information. It's going to allow me to really know what's going on with those muscles. But I know it is a concern with a lot of patients, like, you have to do what, where, and so it can be a little startling, but you think about, you go to your gynecologist, they have to insert that speculum that's not very comfortable. My finger is a lot less intimidating than that. So I think we can get through it. And, there's going to be some techniques I'm going to show you. If we just can't do it, we're going to focus on relaxation. There's a lot of down training sometimes in pelvic floor PT. And sometimes that's just where we start. We might start with some stretches for the hips and legs and breathing exercises, just so we can kind of bring in some of that relaxation. So I know a lot of people are concerned about that internal portion, and it's not everything, but it is a part of it. But it doesn't have to be done that first time. We can kind of take our time a little bit, get to know each other if that makes you more comfortable. But yes, but ultimately I want my patients to be comfortable. I want my patients to feel like, I want to respect my patients, and I want my patients to know that I, value them and want them to get better. So I'm going to respect your wishes. Like, if that's something you just don't want to do, we will try our best to do other things in order to get you where you want to be.
Next question. I still have questions. What are some examples of pelvic floor exercises commonly prescribed?
Examples of pelvic floor exercises. So, a pelvic floor exercise or a pelvic floor muscle contraction is essentially a Kegel. Now, we can utilize the Kegels to help us with urgency. We can utilize Kegels to help us build strength and endurance. We can utilize pelvic floor exercises when we're doing other exercises that we're already doing. Like, if someone's already going to the gym 3 times a week, we can incorporate pelvic floor exercises with that. But essentially, a pelvic floor muscle contraction is a Kegel. I want to know that you're doing the Kegels correctly. Like I said, I'm sitting here. If I say, okay, go ahead and contract your pelvic floor muscles, and I see all of this happening, I see a bunch of like those are your glutes. Let's calm those down. I just want to see your pelvic floor. Like I said, it's your invisible exercise. So when you should be able to do it in sitting and standing, laying down, on your hands and knees, if you can get into that position. So if you're getting a pelvic floor exercise, it just may vary, how and why you're doing it. So I know that was kind of vague, but it's kind of one of those things. I mean, right now, like I can sit here and just hold my pelvic floor muscles and talk to you guys and be able to multitask. Some people, they come in, they're like, wait. And you're just like, all right, when you're ready. So it just varies. So someone might need like complete and utter concentration. I think I did it. Okay. All right. So they can't focus on anything else other than what they're doing. So in order to, really integrate things, we want to be able to do our Kegel contractions, just how we can reach and do things and talk on the phone and removing our muscles in our back and shoulders without really having to think about it. So yes, the numbers keep going up in the chat.
Yeah, another one. Do you know of any other place in town that offers, besides TMH, pelvic floor?
I think there are a couple places that offer. I know, what is that place called? Oh man, there's a place, I think Capital Regional.
Who's changing name?
Okay, maybe that's, I don't remember. I think they have a therapist there. There is a young lady who is doing pelvic floor PT. I believe she's more cash based though, so I don't believe she takes all insurances. She's mostly doing a cash based thing. I believe her name is Weeks. Her last name is Weeks. So she is also doing pelvic floor PT in the area. But yeah, but as far as, I think she also has another young lady working with her also. So I believe that is an option. But yes, so for now, it's not a whole lot of us, but we're here. We have a question out here.
Well, back to your Kegels, is trying to stop your stream of urine, is that a Kegel and is that an effective exercise?
Okay, so I got a question out here. Is stopping your urine a Kegel, and is that effective? So the muscles that you will contract to stop your urine, that is the Kegel contraction. However, that is not when we want to do our Kegel exercises, okay? That is not something we want to do habitually, because when we are urinating, okay, our muscles need to be relaxed. If we are contracting, we are sending a signal to our bladder to, hey, stop urinating. So then we're not emptying our bladder fully, okay? And then that can cause urinary retention. So when we do go, we're not emptying all the way, because as we've started to urinate, the bladder remembers, oh yeah, we're supposed to stop now. So now we're not emptying fully. So that's definitely something that we don't want to do. But I'm trying to be careful with my words here. If you attempt it once, I don't think it's going to cause, lifelong urinary retention. But it's not something I would say, okay, do your Kegels while you're on the toilet. Okay, so that's big no. But yes, we should be able to, like I said, do those Kegel contractions in different positions, laying down on our back, on our side, sitting in a chair, standing, and kind of maybe noticing, like, does it feel different when I'm sitting versus laying down versus standing? Just things like that we should kind of be aware of. Okay.
And going along with that, I have another question about what is your recommended frequency for doing the Kegels, the pelvic floor?
I recommended frequent. So when getting into exercise prescription, if someone does not have any pelvic floor dysfunction, if they're not having urinary incontinence, if they're not having pain, if they're completely okay down there, it's okay to do some Kegels. You know, you can kind of do them, you know, throughout the day when you think about it. However, just like any other muscle, it can get fatigued. You know, it can, you know, get tired. So just how you don't, you know, work out your arm, you don't do bicep curls all day. Don't do your pelvic floor contractions all day, you know, do a few. You know, you can do different types. You can, you know, just contract and relax. You can do some contracting and holding. But maybe try to get up to 20 seconds just to hold your pelvic floor. Can you realize and be aware of your pelvic floor? Can you hold it for 20 seconds? Can you feel it release? So that is going to be important. You know, everyone wants to contract, 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 but can you let it go? Can you relax it? So that's important also. So I can't really give a specific like, oh, everyone should do 10 Kegels a day and, you know, 10 times a day. You know, that could be something to do. But like I said, you wouldn't work out your bicep every day, every of the week. You don't necessarily have to work out your pelvic floor every day of the week. So just kind of thinking of it, you know, it's a muscle just like other muscles in your body. Okay. So, you know, if you want to do 3 sets of 10 Kegel contractions, that's perfectly fine. 3 times a week, that could work. But yes, so it varies. But like I said, if you're having dysfunction of the pelvic floor, I can't really say, you know, if you're having leakage, do this, because I have not done an assessment. I don't know if it is true weakness that you're having, or is it your habits? Is it, you know, tightness actually that you're having? So it can vary, okay? As far as exercise prescription and things like that.
Do you struggle with the medical practitioners using medication as the first, you know, the first thing if a woman complains of?
So it definitely happens. So the question out here, I don't know if you guys can hear, but do I see a lot of practitioners giving medications first instead of therapy? And the answer is yes. I see that sometimes. You know, I see patients, they come in and they're already on, you know, something like a Mirbetric, and they're already on, you know, different things to try to combat their issues. And so, you know, depending on what's going on, you know, patients, you might need a little help, you know, to kind of really, you know, if someone's coming in there like, I have to urinate every 30 minutes and I've started taking this drug, now I can at least make it to an hour. So we want to try to get you to a healthy range, you know, a healthy voiding interval, which is 3 to 4 hours. So think about that. Every 3 to 4 hours, we should be going to the bathroom, okay, to urinate. And so we don't want to be below that, but we don't want to hold all day either. So that 3 to 4 hour range, that's our healthy range. But yes, so that is something that I've seen. And so, you know, I communicate with the doctors as much as I can to reach them. But, you know, it can be something where it's kind of like, okay, you know, you keep using the medication. As a pelvic floor physical therapist, I'm a doctor of physical therapy. I am not a doctor of medicine. So I cannot tell you to stop taking this and don't do that. You know, I will always say, you know, discuss this with your doctor. If this is something that you don't want to do anymore, you know, if, you know, you feel like what we're doing here is helping, you know, I'll always kind of invite the doctor to kind of chime in and say, okay, yes, now you can stop taking this. I'm not going to tell you to take a certain medication because I cannot prescribe medications.
I have one more question in the chat. Somebody,
All right.
you mentioned breathing, and somebody
Yes.
just wanted to know the best way.
Okay, so best way to breathe. So I usually teach a form of diaphragmatic breathing. Okay, so when we're breathing diaphragmatically, think about keeping our chest still. Okay, and you can kind of try this while you're sitting where you're at now. And so when you breathe in, that's when our body is going to relax. A lot of people like to breathe in, and I'm going to do this incorrectly, okay? They like to breathe in, and we do a big chest breath. So we want to kind of switch it up a little bit. We're going to breathe from our belly. And my belly is a little out there right now. We're going to breathe in through our belly. And then exhale. We're going to bring it back down, okay? Keeping our chest still. So we're not doing that. We're breathing out into the belly. And so when we do it like that, that gets that diaphragm that I showed you earlier. That diaphragm relaxes down, and our pelvic floor actually can relax down, okay? And so based off of that, we kind of build from there. So we kind of maybe relax when we inhale, on our exhale, contract pelvic floor. So that's one of the things that we can kind of do to really kind of focus on getting pelvic floor engaged and utilizing our breath, okay? And so we can kind of think about when we're doing any kind of work or activity, like if we're picking up a heavy bag off the floor, or our grandchild, or whatever we're picking up, you know, as we're doing work, that lift, that pelvic floor contraction is going to be on that exhale, okay? So if we are having, you know, issues with that kind of incontinence, you know, we're picking up things and we're having leakage, that might be something we think about when we pick up things that are heavy, okay? So, but that could be something that we can do, just to inhale, exhale, maybe take a couple breaths or so and just put a pelvic floor contraction with your exhale. Okay.
The only other thing I had on the chat was somebody wanted to know about contact information, and I know you said you're moving, but is there a way we could get the contact information for the TMH pelvic floor
Yes.
physical therapy?
Yes.
We could even
I
email it
can-
out to everybody.
Let's see. Yeah. I should have everything memorized, but I did not. Yeah, I should have. I didn't think about that. Okay. Okay, so the phone number to so this number here, and I'll send more information to you. But the number to the office, my office phone number is 850-431-6762. So that is my office phone number. Another pelvic floor PT will have that number. So that's a number that you can call. On the TMH website, if you look up pelvic floor physical therapy, there is like a link, and you can email questions to us and we can respond to that. And I believe the phone number is also there. TMH. Then the phone number, if you call this number, it's actually our front office number, and that is 850-431-7122. So that is the front office number, and that is a good number. So sometimes, I'm not gonna lie, we get really busy, especially during the day. Sometimes voicemails kind of get left, and we can, but the first number I gave you, I usually check that number, or the other therapist checks that line frequently. So if you call that number, we should be able to help you out, okay? At least kind of get you in through the referral process, and make sure you're on the list at least. And now scheduling, we don't schedule our initial evaluation patients. So when scheduling, what usually happens is we get the referral, and then our business manager, Arch Brown, he will call you. He is not your therapist, okay? He is just calling to see when you can get scheduled. And so once he calls you, he'll schedule you, and then we kind of get the ball rolling from there. Okay.
Thank you.
All righty.
Thank you. A warm round of applause. That was a really good presentation. Thank you so much.
No
Very
problem.
informative. We hope to see some of you here next week, same time, same place. And I will send everybody a follow-up email with contact information. Okay. All right. Maureen's going to end the meeting now. Y'all to have a good week. Take care.